It's important to have access to care at all times of the day and night, and one of the important components of that in many organizations is access to a nurse hotline. Nurse hotline make questions and communication available to our military patients after hours, and we work in close coordination with the hotline to share information to make sure that whenever questions are asked and answered, that information is then passed back to primary care providers. I think even more so now, there's a focus on telehealth and emerging technology. We're beginning to communicate appointments through text features, and we have automatic call reminders that are programmed through our telephone systems. Our electronic portal is extremely highly used. I believe 80% of our military patients are accessing their health records through our portal. More and more, we're beginning to do what we would call asynchronous health visits, meaning electronic visits. For example, if one of our patients has a question, they could pose it through the electronic portal, and then their doctor could answer that question later on in the evening. It adds an element of convenience for our patients that don't necessarily have to come in for a visit when they might have had to before, and then it offers the doctors the ability to think through those questions and be prepared to answer them comprehensively. We also have video visits in certain situations where patients are able to have a face-to-face visit through a video rather than in a direct visit, and that could be really convenient if you think about a new mom with a sick child and a couple of toddlers who, instead of having to get everybody packaged up and brought to the car and drive down to the practice, can have a video visit for something that we could manage easily through protocol. Johns Hopkins tries to remain on top of technology, and we'd like to believe that we are a forward, innovative organization.